Good morning, everyone. We come to the last class of reproductive system. This is Dr. Shyma. Today we'll be covering the topic of contraception. Now, if you look at the definition of contraceptives, they are methods used to prevent pregnancy and in some cases to prevent sexually transmitted infections. And sexually transmitted infections are infections that is passed from one person to another through sexual contact. So having unprotected sex can put a person at risk of unwanted pregnancy and also sexually transmitted infections. This class, I would actually like to tell you about the common methods of contraception used, how they work, and how effective they are. To give you all a general information, if you see, India was basically the first country in the world to adopt an official population policy and launch an official family planning program way back in 1952, which remains the mainstay of family planning efforts. And another interesting fact is that in India, among the 48% of the married women who uses modern contraceptive methods, about 3/4 of them uses female sterilization as the most prevalent birth control methods used. Now let's go into the different methods of contraception. So in the first slide, you can see that how the contraceptives are classified. So if you look at the classification, you can see broadly they are divided into 5. You have the barrier method, the intrauterine devices, the hormonal methods, 4th one the post-conceptional methods, and the 5th one you have the permanent methods of contraception. Now if you look at the barrier method, there you can see that it's again subdivided into 2, the physical methods and the chemical methods. Let's go to the second slide. So in physical methods, you need to know the physical methods used in males and also in females. Now in males, condom is the most widely used barrier device. It prevents sperm to be deposited in the vagina. The biggest advantage is that it provides protection against sexually transmitted diseases too. Now in females, the physical method, the uses of diaphragm, which is the most commonly used vaginal barrier. A spermicidal jelly is used along with the diaphragm. And another widely used physical method, contraceptive method in female is the vaginal sponge. So that's about the first subdivision of, I'll just take you all to the first slide. In the barrier method, the first one was physical method, where we have finished discussing about the male physical method, which was the use of condom, and the female physical barrier method used, which was diaphragm, which is commonly used as a vaginal barrier and which is used along with the spermicidal jelly, and the second female barrier is the vaginal sponge. Now we go to the second subdivision, which is the chemical method. Now in chemical methods, if you see, various spermicidal agents like the foams, creams and suppositories are inserted manually into the vagina before intercourse. Basically, these substances which are inserted into the vagina acts as surface active agents that attach themselves to the sperms, and it basically decreases the oxygen uptake and kills them. The chemical methods are not very widely in use because they have very high failure rates. Now the next second division, if you can recollect the first slide, we had the physical method, which are 2 subdivisions, the barrier method, which are the physical method, and the chemical method. The second division was the intrauterine devices. Now if you look at the intrauterine devices, or we commonly abbreviate it as IUDs, I, U and D capital, they are the most effective contraceptive devices for a Paris lady. Now I hope you know that what it means by a Paris lady who has born at least one child. Now the IUDs, normally IUD, the contraceptives or contraception methods of contraceptions is used as a it comes as a 5-mark question for you all. Sometimes they can pick up and ask you as a 3 marker or even a 5 marker, either intrauterine contraceptive devices or the hormonal contraceptive methods, which will be coming up in the coming up slides. Now let's go into or continue with the IUDs. The intrauterine contraceptive devices are basically of 3 generations. You put them into the first, second and the third generation. The first generation IUDs, the Lippes loop falls under it. The second generation intrauterine contraceptive devices, they're actually basically, you can see 3 subdivisions there. The earlier devices were copper 7, copper T 200. The newer devices are copper T variants, T copper 220C, T copper 380A and T copper 380AG. Now the third generation IUDs, Progestasert, it's basically a T-shaped device which is filled with 38 milligram of progesterone. Now let's look at the mechanism of action of intrauterine contraceptive devices, or how exactly the IUDs prevent pregnancy. Now the presence of these small objects in the uterus brings about changes in the uterine endometrium or in the uterus, which interferes with the endometrial preparation for the acceptance of the blastocyst. So what happens finally is the implantation is prevented. Now they also act as, so that's the first mechanism by which IUDs prevent pregnancy. The second one is they also act as a foreign body in the uterine cavity, which causes certain biochemical changes in the endometrium and also the uterine fluid, which will actually interfere with the viability of the gamete. So again, what's happening is implantation is being prevented. So those are the two, the main mechanism of action, but other 2 more which you can actually list down is basically the copper which is present in the IUDs facilitates the cellular reactions in the endometrium. Even the the cervical mucine compositions, and it even impairs sperm motility and also interferes with the capacitation of the sperm. And also the hormone, the third generation IUDs release hormones, and these hormone releasing devices, it increases the viscosity of the cervical mucus by releasing progesterone. Now this will make the uterine mucus very thick so that the sperm cannot enter the uterus. And it also makes the uterine endometrium highly unfavorable for implantation. So that's about the mechanism by which the intrauterine contraceptive devices prevent pregnancy. Now let's see the next important classification where we discuss about the hormonal contraceptives. Now before we actually go into the detail of the hormonal contraceptives, I would like to give you all a brief idea about it. If you look at the hormonal contraception, these methods involve 2 hormones, estrogen and progesterone. The hormonal contraceptives either release progestin or progestin alone. And what estrogen does is, it will prevent the release of an egg, and what progestin does is, it will cause the uterine mucus to thicken and stop the sperm from reaching the egg, or prevents again fertilization. So basically, in whatever forms the hormonal contraceptives are used, either they'll contain there'll be a combination of progestin and estrogen or progestin alone. So let's go to the slide. So the hormonal contraceptives, you can see that it's broadly divided into 2: the oral contraceptive pills and also the depots, which you can call it as, they'll be the slow hormonal releasing formulations. Let's go to the oral contraceptive pills. Oral contraceptive pills can be categorized into 5. You have the combined pill, the progesterone only pill, the post-coital pill, once a month pill, or even the male pill. Now the oral contraceptives, if we go to the detail, the OCPs contain 30 to 35 milligram of estrogen and 0.5 to 1 milligram of progesterone. The pill is given for 21 days from 5th day of the cycle. That's immediately after the bleeding phase ends. Oral contraceptives are based on the principle that estrogen and progesterone will inhibit the release of pituitary gonadotropin, and thereby what would they do? They would prevent ovulation. Now the OCPs, when you look at their efficacy rates, it's considered 100% effective in preventing pregnancy. There are few side effects which can occur if the OCPs are consumed for many years. Now you have the second subdivision of the oral contraceptive pills, which are the post conceptional pills. And before that, I think I would like to give you all a little more details about the side effects of the oral contraceptive pills if taken for I've just you can have a look at the second point where I've mentioned that there can be few side effects when OCPs are consumed for many years. Cardiovascular side effects can be there. They can myocardial infarction, cerebral thrombosis, venous thrombosis, and hypertension have been reported in many cases. And these side effects are seen more common in when the lady is 35 plus, and also in smokers. So hypertension is basically occurring due to prolonged use of OCPs, due to fluid retention, and also due to increased angiotensin level. Estrogen has the capacity to increase the renin-angiotensin activity and thereby increases angiotensin 2 production, and angiotensin 2, you all know, is a potent vasoconstrictor. Carcinogenesis has also been reported in many studies due to prolonged use of OCPs, and there is increased risk of cervical cancer and also breast neoplasia. Hepatic tumors have been reported very rarely in ladies who have been consuming OCPs for a long number of years. And metabolic side effects which are seen with OCPs are the HDL levels decrease, and even the blood coagulability is altered. So when these two happen, when HDL levels decrease and there is variation in the coagulability of the blood, this facilitates atherosclerosis and proneness to myocardial infarction and also stroke. It can also cause glucose intolerance and also insulin resistance. Now if you look at the post conceptional pills, I think we are missing on depots. One second, I'll just go back to the first slide. No, depots, I think it comes as a second major classification. So when you look at the post-conceptional pills are basically contraceptive pills that can be used within 72 hours after intercourse, or it's called as the post-coital contraception. And the post-conceptional pills or the pills which are taken 72 hours after an unprotected sex, it basically contains a high dose of estrogen or 2 large doses 12 hours apart of a combined estrogen progestin oral preparation is normally prescribed, and you can see it available as mifepristone. So before going to the other methods, I think we need to know a little more on the second classification which I have put on the first slide as depots or the slow releasing formulations. So basically these are subcutaneous implants which contains progestogen. It's called as the Norplant, the progesterone capsules or the Norplant. It's implanted beneath the skin, and that will release hormone very slowly, and it can last for almost 5 years. Injectable forms are also there, and basically it's given as an intramuscular injection of progestogen. Substances like Depo-Provera every 3 months is given. That's also an option. Now you can see the third option as vaginal ring, which contains levonorgestrel, which has been found to be around almost 99% effective. And vaginal ring is basically a small flexible ring that can be inserted into the vagina without a physician, and it contains, as I've mentioned earlier, estrogen and progestin, and are basically kept for 3 weeks and removed in the 4th week. The vaginal rings are 99.7% effective with perfect use. So we finish off with the hormonal contraceptives, where we have covered the oral contraceptives, the 5 subdivisions, and also depots, under which injectable preparations, which is a subcutaneous injection, subcutaneous implants are there, the vaginal rings, which all of them are slow hormonal releasing formulations. So now let's go to the other methods. In the other methods, we actually need to discuss about the rhythm method, where it's also called as the safe period method. So basically the rhythm method is the abstinence from sexual intercourse during the fertile period of the cycle. Now the unprotected intercourse should be avoided from the 10th day to the 19th day of the cycle, which is supposed to be the safe period, or the phase during which pregnancy cannot occur. Now the rest of the phase 1 to 9 and from 20th day to the 28th day is considered to be the safe period. So the next the method which comes under the other methods is the coitus interruptus. And in this method, during the fertile period, the male partner withdraws the penis from the vagina before the ejaculation. So what happens is sperm is not deposited in the female genital tract in the fertile period. Next category is breastfeeding. So basically, till the mother continue to nurse the baby with breastfeeding, ovulation does not occur. This is because prolactin secreted during lactation produces lactational amenorrhea by inhibiting the secretion of gonadotropin releasing hormone. Now the last the methods, we come to the male sterilization and the female sterilization method. Sorry. So basically the government of India encourages people of India with different incentives to opt for family planning operations. After a couple have been blessed with 2 or 3 children, it's either done by male or female sterilization. So in male, sterilization is basically performed by vasectomy. So the vas deferens, there is bilateral ligation which is done to the vas deferens, and the very important thing to be remembered here is recanalization can be taken up in future whenever needed. Now when you look at the permanent method of sterilization in female, it's performed by bilateral tubal ligation, and similar with vasectomy, tubal recanalization can also be performed later whenever needed. So here we actually end with our last topic of reproductive system. And please remember that this particular topic of contraception is a very repeatedly asked university question for you all, and contraception as a whole can be asked as a 5 marker, or they can pick up and ask you about intrauterine devices or the hormonal methods. And please remember that whenever any method of contraception is written, please remember to include the mechanism by which that particular method prevents pregnancy. So thank you guys for listening to the class. Please make a mind map, get the topic thorough. Bye.